We begin the examination by asking for the patient's health history, like common or concerning symptoms which include nose bleeding, sore throat, hoarseness, swollen glands, or goiter. I am making sure that the examination equipments are within easy reach. Before I start the examination, I am sanitizing my hands. I am inspecting the anterior and inferior surfaces of the nose and noting for asymmetry or deformity. I am checking for any obstruction by pressing the each ala nasa and by asking the patient to breathe in. I am tilting the head back gently and shining the light on the vestibule to get a view on each nasal vestibule. I am using the largest speculum available to inspect the inside of the nasal passages. I am inserting the otoscope gently and making sure not to touch the sensitive nasal septum. I will repeat the same procedure on the other side of the nose. I am noting the color and condition of the nasal mucosa. The nasal mucosa is normal and no swelling, exudates, or bleeding. I am noting for the deviation or inflammation and perforation of the nasal septum. I am also looking for abnormalities like polyps or ulceration. After the examination, I discard the speculum. I am palpating for sinus tenderness by pressing the frontal sinus and pressing up on the maxillary sinus. Asking the patient to remove any lipstick or dentures. Since the patient didn't have any, we are proceeding to the next examination. I am wearing my gloves. I am inspecting the outer surface of the mouth for symmetry, color, and moisture. I am also noting for any lumps, ulcers, cracking, or scaling. I am inspecting the oral mucosa with the help of the tongue blade for color and ulcers, which can be seen in HSV1, looking for white patches suggesting candidiasis. I am noting the color of the gums, inspecting the gum margins, and inspecting the interdental papillae for swelling or ulceration. I am also inspecting the teeth and noting for discoloration and any missing tooth. I am also looking for any dental caries which can cause bacteremia in the future. I am checking if any tooth is loose. I am inspecting the color and architecture of the hard palate. Can you say ah? As the patient is saying ah, I am noting the movement of the soft palate and vulva, using the tongue blade if the tongue obstructs my view. I am inspecting the anterior and posterior pillars and looking for tonsils. I am also examining the pharynx and redness, exudates, or ulceration. Can you stick your tongue out? I am inspecting the tongue for symmetry and color. I am also inspecting the dorsal surface. I am using my right gloved hand to move the tip of the tongue with the help of a gauze square. I am pushing it to the patient's left and looking for the undersurface and sides of the tongue. I am looking for the white or reddened areas or nodules or ulcers. I am also palpating the tongue with my left gloved hand and feeling an induration. I will do the same process in the other side of the tongue. I am beginning the examination of the neck by looking for symmetry by standing in front of the patient. I am noting for any scars or masses. I am also looking for any enlargement in the parotid or submandibular glands. I am noting any inflammation of the lymph nodes. I am palpating the lymph nodes using the pads of my index finger. I am palpating the anterior superficial and deep cervical chains, including the supraclavicular nodes located anterior and superficial to the sternomastoid. I am noting the lymph node size, shape, delimitation, mobility, consistency, and any tenderness. I am feeling for the preauricular, posterior auricular, occipital, tonsillar, submandibular, submental, superficial cervical, and posterior cervical nodes. I am palpating the posterior cervical chain along the anterior edge of the trapezius and along the posterior edge of the sternomastoid. If there is any enlargement, we have to do a re-examination of the regions and check for their drainage. I am inspecting the trachea for any deviation. I am placing my finger on one side of the trachea and the space between it and the sternomastoid. When compared to the other side, the spaces should be symmetric. I am inspecting the patient's thyroid by first inspecting the neck. I am looking for the gland below the cricoid cartilage. I am using the tangential lighting. I am looking for the lower shadowed border of the thyroid gland. I am asking the patient to sip some water and observe the upward movement of the thyroid gland. I am palpating the thyroid gland and locating the isthmus. I am palpating the right and left lobes. I am looking for the goiter or enlargement of these lobes. Now I am moving behind the patient and placing my fingers on the patient's neck. Now I am again asking the patient to take a sip of water and then to swallow it. I am feeling the thyroid isthmus rising. I am displacing the trachea to the right with the fingers of my left hand. My right fingers are palpating the right lobe. I am doing the same procedure for the left lobe. I am noting the size, shape, and consistency of the thyroid gland and identifying any nodular or tenderness. If the thyroid gland is enlarged, I will listen to the lateral lobe with a stethoscope to detect a bruit, which is a sound similar to the cardiac murmur. Finally, I will summarize and record my findings. Thank you.